Good morning, everyone. I'm Dr. Ramya, Associate Professor, Department of Physiology, Sri Lakshmi Narayana Institute of Medical Sciences, affiliated under Bharat Institute of Higher Education and Research. Today, I'll be discussing about the topic deep sea physiology. Deep sea physiology. The topic as such consists of various aspects of this happening under the depth of the sea, that is, the changes in the atmospheric pressure, the effect of the change in the atmospheric pressure on the human body, then the reversal of the changes when a subject or a person ascends from the depth to the sea level. We'll be dealing with all this one by one. First, before knowing into all those changes, we should know what are the pressure changes which happens under the sea. First, at the atmospheric level, that is at the sea level, the pressure is around 760 millimeters of mercury, which equals 1 atmosphere, which is same as that of the pressure in the lung. But what happens when we descend under the sea? The pressure increases. That is, it increases proportionate to the depth of the descent. That is, for every 10-meter descent under the sea, there will be increase in 1 atmosphere. That is, for about every 33 feet descent, there will be increase in the atmospheric pressure of about 1 atmosphere. Then the total pressure counts for about 1 atmosphere already at the sea level, then an addition of 1 atmosphere according to the descent, then it counts for about 2 atmosphere. Then for every descent of about 10 meter, 1 atmospheric pressure will be added up to it. So depending on the descent, the atmospheric pressure increases proportionately, and depending on the depth of the descent, there is changes in the human body. So commonly people who go under the sea are geyser workers, people who work in a chamber for construction works under the sea, then submarine ship workers, then deep sea diving for occupational purposes or for recreational purposes also. So this is a picture of a geyser. Geyser is nothing but a chamber, I have already told, used for work under the sea. This is a scuba. Most of us already know what is scuba. It is nothing but self-contained underwater breathing apparatus. This self-contained underwater breathing apparatus, as the name suggests, is nothing but a breathing apparatus which is helpful in breathing under the sea. So these are the parts of the scuba. This is the cylinder which contains gases and a high pressure. This is the regulator valve to adjust the air pressure, and this is the mouthpiece and the regulator to adjust the inhalation of air. So normally this scuba tank, it contains a mixture of gases, that is compressed gases at high pressure. So why should we have gases delivered at high pressure? Because the external atmospheric pressure is high according to the descent, depth of the descent. Then if you are going to inhale air at a very lower pressure, it cannot be adequate for proper expansion of the chest wall and the abdominal cavity. So we need to inhale gases at a higher pressure. So this is the purpose of the scuba tank and the cylinder. So whenever we inhale gases at a higher pressure, it helps in the equalization of pressure from the atmosphere to the lungs. And it also provides adequate expansion of the chest wall of the abdomen for proper respiratory activity to carry on. So when we inhale air at a high pressure, we go down the sea at different depth. There are few changes which occurs in the human body. First, it may occur due to mechanical effects, that is the barotrauma, that is due to the change atmosphere. There is increase in the higher atmospheric pressure. It causes mechanical changes. Then it also occurs as a result of high pressure on the respiratory gases, because we are delivering gases at a high pressure. So this will affect the partial pressure of gases inside the body. So we'll be dealing with those changes which happens due to change in the partial pressure of gases inside the body. First, we'll be dealing with the physiological changes which occurs as a result of mechanical trauma. First, for example, when a person descends down to a depth of about 30 meter in the sense it is about 100 feet, because every 10 meter accounts for 33 feet, which we have already seen in the previous slide. So for every 10 meter, we know there is increase in one atmosphere. So if it is 30 meter, there is increase in about 3 atmosphere, which is added up to the pressure in the sea level. 1 atmosphere, it counts for about 4 atmosphere in total. So there will be increase in high atmosphere pressure, which causes mechanical compression. Think if the pressure inside the body is less and the pressure outside the body is almost 4 times more than that, what happens? It causes mechanical compression from the external to the internal. So because of that mechanical compression, sometimes there occurs caving of the chest wall due to indrawing of the sternum, as shown in this picture. And sometimes there is shifting of heart from its normal position to the left because of this caving. There is damage to the face, and the cavities inside the body, they get squeezed off. So, for example, paranasal sinuses and air. Though the cavity contains air, because of the external compression, it gets squeezed off, the middle ear gets squeezed off. Because of the squeezing of the middle ear, there will be a rupture of inward pulling of the tympanic membrane, sometimes rupture of tympanic membrane also happens. Then we'll move on to the physiological effects occurring as a result of high pressure. So there are few changes which occurs as a result of it. First, there is effect of increased partial pressure of oxygen. Then we'll be dealing with the effect of increased partial pressure of nitrogen osmosis. Then the effect of increased carbon dioxide buildup inside the body. First, the effect of increased partial pressure of oxygen. First, whenever we inhale air from the scuba tank, that is from the cylinder, which is highly concentrated with oxygen, that is 100% oxygen. What happens? Depending on the pressure, its solubility increases. So what happens to the solubility of oxygen in the blood? It increases from about 2 to 9 ml per 100 ml. So whenever a higher amount of oxygen is being delivered to the tissue, the partial pressure of oxygen also increases. So whenever there is increase in the partial pressure of oxygen, it results in the formation of reactive oxygen species like hydrogen peroxide and superoxide anion. So these free radical has a tendency to damage the cell membrane, resulting in complications. So whenever the subject is being exposed to higher concentration of oxygen, that is 100% oxygen for a shorter duration of time, he undergoes changes in the body and experiences symptoms like nausea, dizziness, disorientation, convulsions, and sometimes leading to coma also. But when the subject is being exposed to hyperbaric oxygen therapy or hyperbaric 100% oxygen for a prolonged time under high pressure, that is under the sea, we saw about 30 feet, 40 feet, what happens? The subject undergoes symptoms due to irritation of airways, bronchitis, pneumonitis, and it results in pulmonary edema and atelectasis. So 100% oxygen when it is being given at higher pressure, it results in all these complications. So how can we prevent this? Instead of giving 100% oxygen at a high pressure, what we can do? We can combine oxygen with nitrogen. The proportion of 20 is to 80. Why do we give in this proportion 20 and 80? Because we all knew already that the normal composition of inspired air at sea level is oxygen at 21% and nitrogen at 78%. It's almost similar to the concentration of the atmospheric air at the sea level. That is why instead of giving 100% oxygen at the tank, we give a combination of gases, that is mainly the oxygen and nitrogen, compressed and given and delivered at a high pressure to the human body. Next, we'll be dealing with the effects of nitrogen. That is, nitrogen has two principal effects on the body. What happens when the nitrogen level increases in the body? That is, whenever there is increase in the partial pressure of nitrogen. So instead of giving 100% oxygen, when we replace it with oxygen and nitrogen, sometimes the nitrogen has its ill effects on the body causing nitrogen narcosis. Narcotic effect is nothing but anesthetic effect on the body. And sometimes when we ascend up from the depth of the sea to the sea level at a rapid rate, the subject or a person also undergoes decompression sickness. We'll be dealing with both of this one by one. First, the nitrogen has the tendency to dissolve in the body at a very rapid rate, especially in the lipids of the body. So, what are the structures which are highly rich in lipids? The neurons. So, it gets easily dissolved in the fat content of the body, which results in the alteration of the electrical conductance of the neuron, reducing its excitability, resulting in narcotic effect or anesthetic effect. So, whenever the nitrogen concentration is being increased, that is, the partial pressure of nitrogen increases in the body, what happens? At different depth under the sea, it causes different effects in the body. First, for example, at a depth of about 100 to 120 feet. So what happens? The subject or the person who descends down under the sea, breathing a combination of oxygen and nitrogen at high pressure, undergoes a symptom called euphoria. Euphoria is nothing but a sense of well-being, an elated sense of well-being in particular. So when he further descends down to about 150 to 200 feet under the sea, he becomes drowsy and sometimes muscular incoordination also occurs. When the subject further descends down to a deeper depth of about 200 to 250 feet, all symptoms of narcosis, that is anesthesia, occurs. First, there will be alteration in intellectual function of the person. The subject becomes unconscious and leading to coma. So, if all the symptoms occurs or develops in the person, what happens? Will he be able to swim properly and ascend up to the sea level? No. So, he loses conscious, he becomes unconscious, then he reaches a state of coma. So, how can it be prevented? It can be prevented by giving some other gas in the place of nitrogen. So this slide, if you see, it shows the summary of what we have discussed for the part 3 slides. That is, nitrogen has the capacity or the ability to dissolve in the body at a very rapid rate, especially the lipid-rich tissues and the cells. So we all know that the neurons are highly rich in lipids. So it dissolves in the neurons first. The cell, it alters the conductance of the neuron, resulting in narcotic effect, resulting in nitrogen narcosis. So I've already told it can be prevented by replacing nitrogen with one other gas. Here it is nothing but the helium. So when nitrogen is being replaced with helium, we can prevent all those ill effects of nitrogen caused to the human body under different depths. But if you notice here, the oxygen and nitrogen is given at the proportion of 5 is to 95, not as it of oxygen and nitrogen, which was given at the proportion of 20 and 80. Why do we reduce the concentration of oxygen to 5? Because we all already knew that the partial pressure depends on the percentage composition of air and the atmospheric pressure. As we descend down under the sea, the atmospheric pressure increases. For every 10-meter depth, there is increase in 1 atmosphere. So depending on the depth of the sea, the atmospheric pressure increases. So what can we do? We can alter the composition of the gas which is being delivered to the respiratory system. That is, here instead of giving 20% of oxygen, we can reduce the concentration of oxygen to 5% to reduce the toxic effect of it. So 5 is to 95% of helium is given in the place of oxygen and nitrogen. This is how it can be prevented. Then we move on to the next. This is the effect of carbon dioxide buildup. So this happens whenever there is some problem in the breathing apparatus. What happens? The carbon dioxide will be inhaled again and again into the respiratory system, into the body. there will be collection of carbon dioxide in the body. The partial pressure of carbon dioxide increases above the normal range. We all knew that the partial pressure of carbon dioxide is about 40 millimeters. But what happens here due to collection of excess carbon dioxide? The partial pressure of carbon dioxide increases to about 60 to 80. So almost the double of the normal range. So what it will do? It results in respiratory acidosis and leading to carbon dioxide narcosis. So now we have seen the effect of the descent under the sea at various depths, both mechanical and the change in the pressure of the gases. Now we will move on to the next aspect, that is the decompression sickness. Decompression sickness is nothing but it is the changes which occurs in the body when a person rapidly ascends to the sea level from the depth of the sea. That is ascending to a lower atmospheric pressure at a rapid rate from a high atmospheric pressure. So this is called as decompression sickness. So this decompression sickness is also called as Addison's disease, dysbarism, dense compressed air sickness, and diverse paralysis. All these names have a reason for it, which we'll be dealing in the upcoming slides. So I've already told that the decompression sickness occurs when a subject ascends from a higher atmospheric pressure, that is under the sea at a deeper sea level, to the sea level where the atmospheric pressure is low. So this occurs particularly when the subject ascends very rapidly and the reduction of pressure is more than 50% at a rapid rate when compared to the deep sea level to the sea level. So we all know that every 10-meter depth accounts for about 1 atmospheric pressure increase. So when the pressure has been decreased rapidly for more than 50%, from a deeper sea level to the sea level, when the person ascends very rapidly, he undergoes a condition called decompression sickness. So, but what happens when a subject ascends at a slower rate? When a subject ascends at a slower rate, what happens? The nitrogen gets released into the blood and gets eliminated by the lungs. But when a subject ascends up very rapidly, what happens? The nitrogen forms bubbles and gets released into the tissues and the blood and reaches various blood vessels. And depending on the site of the blood vessels it is reaching, it causes symptoms related to the particular system and results in decompression sickness. But in mild forms, if the bubbles formed are very less, it results in fatigue, drowsiness, nausea, and skin itches. But in severe forms, what happens? These bubbles goes and blocks the blood vessels of the multiple system and results in very severe symptoms, sometimes in tissues, sometimes in muscles, sometimes in joints, and depending on the system where it lodges, the symptoms develop. Now we'll be seeing with the different blood vessels in which these bubbles lodges and produces symptoms. First, the blood vessels of the spinal cord. What happens whenever these bubbles reaches the blood vessels of the spinal cord? It results in symptoms of sensory and motor weaknesses, resulting in paresthesia, motor weaknesses, paralysis, sometimes leading to respiratory failure also. So all the symptoms caused by this block in the blood vessels of the spinal cord is referred to as diverse paralysis. Next, whenever these bubbles reaches the cerebral blood vessels, it results in disorientation, alteration in the intellectual function, stroke, speech and visual disturbances. This bubbles when they reach the pulmonary blood vessels, it results in dyspnea and cough, leading to choke. These are whenever it reaches the alveoli, sometimes it causes a rupture of alveoli resulting in chest pain and tachypnea also. In coronary blood vessels, it causes myocardial ischemia, a myocardial infarction resulting in chest pain. Whenever these bubble reaches the joints in the muscle, it causes pain in the joints, pain in the muscles. That's why it is called as bends. In the gastrointestinal system, it causes painful distension of the stomach and the intestine. So depending on the site of lodgement of the bubble, the symptom develops. So when it is developed in the blood vessels of the spinal cord, it causes paralysis. That is why it is called as diverse paralysis. In the respiratory system, it is related to, it is called chokes. In the joints and muscles, it is bends. That is why this decompression sickness has multiple names as dyspareunism, chokes, diverse paralysis, bends, compressed air sickness, all this. Next, this picture depicts the bubbles in the different system. We can note down. See here, we can note down that there is air bubble in the coronary vessels, air bubble in the alveoli, here air bubbles in the blood vessels to the carotid arteries. So this picture depicts the lodging of bubbles in the various blood vessels. See here, whenever the bubbles goes and enters the alveoli expand. Finally, when it reaches the maximum distension, there is a rupture of alveoli. So whenever it ruptures, the air enters the blood vessel causing air embolism. So how can it be prevented? It can be prevented by oxygen helium. It can be prevented by oxygen helium mixture. So we have already seen in the previous slide, oxygen and the helium can be given in the proportion of 5:95. Oxygen at a concentration of 5 and helium at a concentration of 95. Why do we give oxygen at a very lower concentration? Because we have already discussed that the atmospheric pressure and the percentage composition of air will determine the partial pressure. We cannot alter the atmospheric pressure under the sea, so we are altering the percentage composition of air being delivered to the human body. So we are reducing the percentage composition of gas to reduce the ill effects of high partial pressure in the body. And the nitrogen is being replaced by helium. So what are the advantages of using helium oxygen mixture instead of nitrogen oxygen mixture? So helium is comparatively less narcotic than that of nitrogen. That is about only 1/5 of the nitrogen. And the resistance to airflow is very less in helium when compared to nitrogen. Helium, because the helium density is only 1/7 of the nitrogen. So there is work of breathing required for the helium to get exhaled is very less when compared to nitrogen. Then solubility, if we see, the solubility of helium is only about 50% when compared to the solubility of nitrogen. So this reduces the quantity of bubble formation in the tissue, and the diffusion capacity of helium is very fast when compared to the nitrogen. So these are the advantages of using helium in the place of nitrogen to prevent the occurrence of decompression, sickness and nitrogen narcosis. Then apart from replacing nitrogen by helium, what are the other methods by which we can prevent decompression sickness? It can be prevented by slow ascent. Slow ascent in the sense the pressure reduction should not be more than 50% when a subject ascends from the deep sea level to the sea level. That means he has to ascend at a very slow rate that there is no much of pressure changes more than 50%. For following this person should give a mandatory stop in between to prevent the formation of bubbles. That is, for every 10 to 20 meter ascent, there should be a mandatory stop without ascent, and the gap should be given without ascending. for proper exhalation of bubbles which are formed as a result of ascent. So when a mandatory stop is given in between the ascent at a particular distance, what happens? The rate of bubble collection and its lodgement in the different blood vessels will be decreased, and there will be more time available for the exhalation of bubbles into the external atmosphere. When the bubbles, nitrogen bubbles are exhaled into the atmosphere, what happens? The chances of these bubbles getting lodged into the blood vessel decreases, and the symptoms developed will also be minimized. That is why mandatory stop should be given during ascent, and the ascent has to be done at a very slower rate. The pressure reduction not more than 50%. Okay. Now, instead of following all this, that is by replacing, we can replace. Otherwise, as I've told you, slow ascent can be given. Otherwise, mandatory stop. So instead of ascending up to the sea level at a slower rate, and also by giving mandatory stops, that is development of decompression sickness. What do we do to treat the decompression sickness? We have a tank called tank decompressor. That is, what happens? The person who ascends to the sea level will be put inside this high pressure chamber, and rapid decompression is done in the high pressure chamber. Why do we rapidly decompress? Because when the person ascends up to the sea level, there is rapid decompression, because of which the nitrogen escapes from the tissues, from the body fluids, and forms a lot of bubbles and resulting in the development of multiple symptoms. That is why we rapidly recompress, which happens at a high atmospheric pressure. Then what happens? All those bubbles gets dissolved in the body fluids and enters the tissues. So now there is a reversal of symptoms, and there will be slow reduction of pressure leading to slow decompression. So when a slow decompression is made, all those symptoms developing as a result of a rapid recompression will be avoided. So this can be done to follow a slow procedure of decreasing the external pressure. That is why we are doing it in a chamber where the subject is exposed to a high pressure. When we are exposed to high pressure, there is a rapid recompression resulting in the dissolution of gases into the body fluid, then slowly decompressing by slow reduction in the pressure. So when we do slow decompression, what happens? There is enough or sufficient time for the gases released to be exhaled out, which is not happening in rapid decompression. So when the enough time is available for decompression to occur, the gases get exhaled out. So if the gases get properly exhaled out, there will not be formation of symptoms resulting in all those ill effects. So sometimes 100% oxygen therapy may also be useful in this kind. Most of the time, when the subject is being slowly decompressed, he reverses back to normal. But very rarely, they may have a mild neurological deficit. This is how we treat the decompression sickness. As a summary of today's class, I will be telling few points in a nutshell. First, when we think about deep sea physiology, we should know what are the pressure changes which happens at different depth of the sea. So at the sea level, it is 1 atmosphere. For every descent of 10-meter depth, there is increase in 1 atmosphere. So when we breathe in only 100% oxygen, when we descend down, it results in acute oxygen toxicity. Both acute and chronic oxygen toxicity occurs. So to prevent that, we use combination of gases, that is oxygen and nitrogen in the ratio of 20 and 80. But what happens at high atmospheric pressure? It's because of the nitrogen's ability to dissolve faster. It dissolves in the tissues of the body, especially in the lipids. Lipids are rich in neurons, so dissolves in the neuron at a very faster rate, reducing its excitability, leading to narcosis. How do we prevent that? We can prevent this by replacing nitrogen with helium and by reducing the concentration of oxygen from 20 to 5%. So why do we reduce the concentration of oxygen? To reduce the partial pressure of oxygen in the body. Okay. So when we do this, we can escape from nitrogen osmosis and oxygen toxicity. Okay. Once we have descended down, we have to ascend up to the sea level now. Once we ascend up to the sea level at a very slower pace by following mandatory stops and giving enough time for exhalation of the gases, there will not be any problem. Very minor problems will be there. But what happens when the ascent occurs at a faster rate with a rapid reduction of pressure for about more than 50%? Rapid reduction of pressure more than 50%. There is a development of decompression sickness. This decompression sickness has various names like dysbarism, compressed air sickness, chokes, bends, diverse paralysis, depending on the symptoms they develop. So here, depending on the site of bubble lodgement, the subject develops the symptom. So whenever it reaches the spinal cord blood vessels, it results in motor and sensory weakness and paralysis. That is why it is called as diverse paralysis. In respiratory system, dyspnea, resulting in chokes. Sometimes it causes maximum distension of the alveoli, rupture of alveoli, release of air embolism into the blood vessels, resulting in air embolism. Then in muscles and joints causing bends. So all the symptoms will develop. How do we prevent them? We can prevent this by replacing nitrogen with helium and by reducing the concentration of oxygen to 5. What is the advantage of using helium? Helium is less soluble, less narcotic, and the resistance to airflow is less, so it can diffuse out faster when compared to nitrogen. And it can also be prevented by slow ascent and by giving mandatory stops in between. And instead of doing all this also, if a person develops decompression sickness, it can be treated by tank decompression. First, rapid recompression in a high pressure chamber and slowly decompressing by slowly reducing the pressure. And sometimes 100% oxygen therapy is also useful. And most commonly, the subject recovers from the symptom and very rarely they develop mild neurological deficits. So this is about deep sea physiology. These are the take-home points. Thank you for listening to the class.